Hi, it's Marsh from the Health and Wellbeing with Marsh channel. Hope everybody's well. Today I'd like to talk about IBS, its symptoms, its causes, treatments and tips. Lots of tips. What is it? It's a common condition which affects the digestive system. It can cause diarrhea, constipation, stomach cramps, bloating. It can last for sometimes just a few days, weeks, and also months. It's normal for it to be a lifelong problem, and it does cause issues in the day-to-day routine of life. There isn't a cure, but with medicine and diet changes, it can be managed and your situation greatly improved if you wish. The exact cause isn't known, but linked to food passed through the gut either too fast or too slow, oversensitive nerves, and a family history of IBS is also common. Symptoms: stomach cramps are usually painful after eating and feel better generally after a poo. Bloating, your tummy will feel full and swollen. Diarrhea, you may have watery poo, and sometimes the need is very urgent to go to the loo. And constipation, you may strain when pooing. Feel like you've not emptied your bowels fully. Other symptoms include flatulence, passing mucus from your bottom. Also, you can feel tired and lethargic, total lack of energy, nausea can set in, backache. You can have issues peeing and even incontinence. The condition get flare-ups, normally brought on by too much alcohol. Caffeine can be another trigger. And certain other foods such as fatty or spicy foods. Also, stress and anxiety can bring the condition on. If it is that you need to seek an urgent appointment, normally for some of the following reasons: that you've had a dramatic loss of weight for no reason, if you've got bloody diarrhea or blood from the bottom, a swelling or hard lump in the tummy. Palpitations, noticeable irregular heartbeats, shortness of breath, and sometimes pale skin is associated. When it comes to meeting the doctor, you will be asked what symptoms you've got and the frequency of them and how they come and they go, and he will try and ascertain what it is that the trigger points are of bringing this on. After what foods. Say how long you've had them for. It may be worthwhile recording what it is that you're eating, yeah, and trying to ascertain and go along with as much information to the doctors as you can. Nothing wrong in writing it down to help you to remember. There isn't a test for IBS, but you may receive some other tests to try and rule out other things. Such as tests for your blood for infections, or it might be that they wish to take poo samples. As we were saying earlier, there's no magical cure for the IBS, but there are certain tips what we can give you, such as have as many home-cooked meals as you can, freshly cooked with freshly ingredients. Keep a diary each day of what it is that you've eaten, along with any symptoms what you get after eating those particular types of food. Again, it will help you to avoid certain triggers. Please do try and find ways to relax. Get plenty of exercise. Try probiotics for a month to see if they can help. Don't delay or skip meals, or even eat them too quickly. Yeah, don't eat too many fatty processed meals. Don't eat too many spicy meals. Try and keep to a maximum of 3 lots of fresh fruit a day. Again, I said maximum, and the normal portion of a fruit a day is 80 grams. So no more, please, than 3 times 80 grams. Try and keep to 3 cups of coffee a day, maximum. Coffee has been found to be a regular trigger point. Try and not have too many fizzy pops. Same again with alcohol. Try and not have too much alcohol. Drinking plenty of water will give you plenty of relief from the constipation and make the poo softer. Increase the amount of soluble fibres that you eat. Try and increase your oats, pulses, peeled potatoes and linseeds. Ask your doctor about certain laxatives. Avoid foods that are too hard to digest. Avoid foods containing a sweetener called, let me have a look at that, sorbitol. Yeah, apparently that can be a trigger on its own. A certain sweetener called sorbitol in the foods. Try to use peppermint oil. Reduce diarrhea by cutting down on high fibres, such as like within the brown bread, brown rice, nuts and various seeds. Try some Imodium, yeah, and see if that can help settle the stomach. Again, a lot of it is trying to ascertain the trigger point of what it is that we have each day and what affects you. And a very important thing, as I said earlier, please keep notes on what affects certain foods and, if you wish, the timing of the effect of when they kick in, yeah, as a result of what you've eaten. If anything, I hope it's giving you a great, more awareness today. If you like the video, please like and subscribe, and we hope to see you again in the near future. Keep up the good fight. Mash, bye.